Hello and welcome to the show. I'm trichologist Lisa Akbari, your hair doctor, and today I'm super uber excited about the show. I'll pop my collar because I'm going to do some things with my hair. We're going to talk about scalp today. We're going to talk about your scalp. As you can see, I'm here on the WDI studios and iHeartRadio. I have, if you listening to me or watching me on YouTube, you'll see I've got my backdrop. Woo! Ask the Hair Doctor. But if you're live on the radio with me in iHeartRadio in the WDI studios, then you are not able to see my backdrop. But you can always go to YouTube and see it. Well, I'm here today. I'm really excited about today's show. We're going to talk about the scalp. Okay? Scalp is skin. Scalp is the foundation to healthy hair. I always tell my patients, your hair is an appendage of your scalp. And they go, I know that. Well, many times the way we treat our hair, we act as if our hair is just floating above our head, but it's not. It's an appendage of the scalp. So it's crucial important for us to take care of that foundation called the scalp. So today we're going to talk about the scalp. Scalp pulse, scalp bruising, scalp tender, scalp itch, scalp sores, all of those things. What in the world am I to do? Why does my scalp itch so much? Why is my scalp flaking so much? Why is it tender? What causes these things? And we're going to just talk about it. We're going to talk a little bit about the skin, this largest organ of the body, the skin. And so welcome to the show. Welcome. Thank you so much. You're welcome to email me. You can do so by emailing me, lisa@lisaakbari.com. And I'm going to open up my chat room so that you're going to see some of you have already started to log on. So we're going to open a chat room. And on my chat room, I want you to be able to ask me questions. So we're going to do that. So let's make sure this chat room is open and I can say hello to everyone. So guys, welcome to the show. Thank you so much for tuning in. And those of you who are tuning in on YouTube live watching me, then I apologize for the delay. But those of you who are watching me on the radio, I'm right on time. Thank you guys so much. I'm here each and every week, and I'm here live with you, talking to you about your hair, your scalp. So you can email me or you can chat with me. I'm chatting. If you missed the show, you can always, or you want to tell a friend about it, you can always go to my YouTube page and I have all of those archives. Make sure you subscribe to me so you know every time I'm doing something new. So guys, I do apologize for coming on late, the folks that are on the internet watching me live. And those of you that are watching me, listening to me for the radio, you know I'm right on time. Okay, as I said, let me say hello to everyone on our YouTube page. Hi, guys. Welcome to the show. I'm trying to multitask here. It's not working very well. Get ready. Ask your questions, and I'm here to answer them. And so you can chat with me, or I'm going to go in my email box a little bit, and I'm going to, just kind of talk to everyone about, try to get their questions. And I'm just really excited about the show and all this good stuff. Yada, 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 yada. You know, I'm always overly excited about the show. So I am, because, I'm so blessed to be able to, because I feel like God is good. God is a good God. He is a great, mighty God. And I thank him for allowing me to do this show. So here we go. There it is. Okay, so let's get this back up here and see. So if you have any questions, I see folks logging in on my chat. You know, these computers, it's so crazy. You can't live with them and you can't live without them. And I tell you, I'm trying to make some things move around here and they're just not moving. Okay, well, I'm going to go back and let's get started on the show. There's a couple of things I want to talk about. I mean, I've got some celebrity news, but we're going to make that wait till next week because I think it's really important what we're going to talk about today. I mean, there's some other things that I wanted to mention, like talking about clarifying shampoos and how important they are to your hair and getting your scalp clean and your hair clean. And there's, you know, we want to talk about color and porosity, but really today we want to talk a lot about your scalp because so many people have like, we're going to talk about braids and a healthy scalp because so many people wear braids all year long. And some people wear braids as their summer fix. I have my neighbor, she recently got married and she has long hair and it's natural. And so she did a press out with her hair like flat iron. And then she's there, her and her husband going on a cruise. So she decided that she's going to wear braids or these faux locks. You know, they look like fake locks. And I was thinking to myself, what about her hairline? She's never worn this before. What about her getting them too tight? So I sent her this text saying, okay, this is what you need to do for your scalp. This is what you need to do for your hair. Make sure they don't braid your hairline. Make sure she doesn't put them too tight to the hair, not to the skin. And I went by on last evening and I checked her out and took her some products. So sweet. I took her some products, sweet little couple, I mean, and she did exactly what I said. So the point I'm making is there are a lot of people who have problems with an itchy scalp and damaged scalp and they lose their hairline. She was like, I don't want to lose my quote unquote itches. She don't want to lose her hairline. And the piece that I pointed out to her was you can wear these braids and I know, or these faux locks, and I know it's convenient for you, but you can wear them, but you just have to be careful to pay attention to how it's affecting your scalp. And so many people suffer with itchy scalp. So I gave her one of our little travel kits and with her clarifying shampoo. And I told her to make sure that whatever was put in her hair was something that you can actually shampoo, because so often, guys, and this is something you need to remember, when you're wearing added hair or when you're doing anything relating to your hair and your scalp and it relates to a style, you need to make sure that you can shampoo that. And I didn't realize until several years ago that there are certain types of styles that you can get, and your loctician, braidtician, weavetician will say to you, don't shampoo this. It'll ruin the hairstyle. Well, if you're going to wear it for more than 3 days, you need to shampoo it. So that's one of the things I said to her. So she had her instructions and she did really well. She said to her loctician and braidtician that I do not want my hairline braided. Take those little hairs, smooth them forward, and then braid everything behind it in the terminal here, right up in the body of the head. So this here, I gave her some moisturizer, our Moisture Plus moisturizer, and I said, lay it down with that. Don't, you know how you have these braiders that are so neat and they're perfectionists? Don't let them pull your hairline here, because what happens, that hairline here will break because of the traction. Traction pulls it. It causes two problems. Problematic, very problematic. One, it will break the hair, and two, it could pull the hair completely from the follicle, which could cause a problem with a form of alopecia. And depending on if inflammation occurs, it could cause scarring, which could destroy the follicle. So there's so many things that could happen. So I mentioned that. So she did, her whole hairline was out, and I said to tight to the braid or tight to the hair, not to the scalp. And what that meant is don't pull and braid. Just make sure you do like a plait at the base, or make sure that you're able to, when you first do the first part of the braid, make sure you're able to move that little section that's right on the scalp, that where the hair connects to the scalp, make sure you can move that back and forth so you will see whether or not it's too tight. And get like a little tip of your fingernail or pinky underneath there. And as long as you can do that, then you're great. And so when you sleep, it won't cause the traction. Because sometimes you have a braider or loctician or a weave-tician to do your hair and weave or braid or lock your hair, and it's okay to walk around. But the minute you lay down on the pillow, then you're tossing and turning and you're pulling. So that's why we see the traction all along the hairline. It even times in the body of the head. It's particularly with locks. We see a lot of that. In braids and weave, I mean, all of it. We really see it. So I gave her orders, and then I gave her some hair vitamin to spray at the base of her hair all throughout so that she would have some elasticity in the strand, just in case it pulled the strand a little bit. And then I gave her scalp treatments. That's what she needed to put at the base of the scalp. And then also she needed the oil she needed in a jar to put between her parts. So she's ready. She's got shampoo and conditioner too. Don't let me forget that. So she's going to be ready. She's going to be free to swim and get her head wet and go back in her cabin, and then she can clean. So that was my little story about real life things that I deal with people. And this was a neighbor. Just think about my patients, the amount of patients who come in with scalp problems. So there's a lot going on with that. So one of the things that we have to think about, there are people who say they have all these recipes to a healthy scalp while wearing braids. And I want to kind of talk about that a little bit because, do we have a little pause here? I tell you, the internet can't live with it, can't live without it. Okay, so let's see what we've got here. If we can get our everything to keep moving. Hopefully you guys have not having any issues with your internet. Hopefully, prayerfully. So we're going to be praying about that. Okay, so we don't need this one. Okay, guys, so I'm online. So if you're just tuning in for the very first time, I'm trichologist Lisa Akbari, your hair doctor. And today we're talking about your scalp. We're talking about your scalp and how you need to take care of your scalp. How your scalp is the foundation to healthy hair. And I'm here answering your questions. My chat room is open. You're welcome to chat with me today if you like. You can do so by chatting. Let's see if we can get to. You can do so by chatting, going to my YouTube page and chatting with me that way. Or you can, let's go back to this one. Okay. Or you can just do so by making sure that let's see if we can get empty. Okay. Oh, you can do so by chatting or emailing me, lisa@lisaakbari.com. Guys, I have a problem with multitasking. I'm trying to get my little emojis to hide so I can see my chat room, but I'm not able to see it. I don't know. Maybe I have it there. So I thought someone did come in and chat with me. So let's do that. I have such a hard time with my technology sometimes. It's like, what is going on? Okay, symbols. I'm trying to close it, and it's just like, it's not letting me. It says hide emojis winking. Okay, anyways. Is my raised participation proper? Chat. Okay. Okay, well, welcome to the show. Let's get started. Okay, we talked about the braids and how one of my neighbors, and we talked about how I helped her with it. So if you missed that, you can it's going to be archived. You can go back and listen to the beginning. All right, so let's get back to some of the things. We're going to talk about some of the recipes people have online, but let's talk about flakes. Let's talk about our scalp, and let's talk about flakes, because not all flakes are equal. You have flakes, but with the naked eye, it all looks the same. But when you look at it microscopically, it's a difference. I'm a trichologist, and basically what I do hair and scalp examinations. And when I do that, I allow an individual to really find out what's really going on with their hair. And so I'm pretty excited about that. So one of the things I look at is the scalp. I want to see how well the scalp is doing. I want to really see that foundation, because when you're talking about growing hair, when you talk about obtaining length, in other words, growing hair and obtaining length, when you're talking about preventing problems with itchy scalp, you really have to, flaky scalp, tender scalp, you really have to look at the way, the environment the scalp is in. So I'm going to do that. But before we do, I just realized I still have my hair pulled up. All right, so let's take my hair down. Of course, you know, I'm using my trusty scrunchie. Yay, I'm excited. And I use this headband because I may keep it up because I like having my collar pop. So yeah, let's put this one on. This is the one that has a little more grip, but it's still nylon. It has a nice little air holes. And I'm just going to take my hair and I'm going to show my little white hairs. And I'm so too young to have those. Really? But I wanted to have a really high afro ponytail. Well, not ponytail, but afro puff. Really high afro puff. There we go. Cutie pie. All right, there we go. I've got my collar pop because you guys know I love to do that. Okay, so if you're just tuning in for the very first time, I'm trichologist Lisa Akbari, your hair doctor, and today we're talking about the hair and scalp. But we're really talking about and going to focus on the scalp. We're going to focus on how this makes a difference in healthy hair growth. But we're going to also focus first on dandruff. Is it dandruff or is it not dandruff? Okay, that's the question. Number one, not all flakes are equal, and I said that. You have environmental, cosmetic, and scalp pollutants. And let me just tell you, those are three categories of pretty much things that can pollute your scalp. Now, under that category, you can have certain types of pollutants, environmental, dust and debris, or under scalp, you can basically have scalp pollutants like dead skin cells and everything that's associated with what the body dumps out, the waste and salt and all of that when you're sweating. Then you can have cosmetic pollutants, and this is a biggie because so many are still co-washing, so many are still no pooing, so many are still using conditioning shampoos instead of clarifying shampoos. And we'll talk about clarifying a little more. I know some of you are still afraid of clarifying shampoos, but I'm going to help you out with that one, okay? All right, so 3 categories of pollutants. 1, scalp pollutant is pretty standard. When your scalp renews itself, your entire body, it does something called shedding of its cells. The epidermis is shedding away those cells. Well, your scalp does that too. So your scalp sheds away. That is a form of, when it becomes excessive, it becomes a form of dandruff. Now, dandruff by definition is just basically an excessive peeling of the scalp. So when you have an excessive peeling of the scalp, you have to have your scalp examined first by a trichologist. If the trichologist, once they identify what this is, what category, then they will treat. If they can't identify what this is, then they will make a recommendation to a dermatologist who is a medical doctor. Trichologists are not generally medical doctors. We are drugless practitioners, and basically what we do, we work with natural treatments. Some of us are in the cosmetology field, esthetician, skincare. Some of us are in the medical field, but trichologists basically, just because you're a trichologist does not mean you're a medical doctor. So trichologists always have to have either, if they're not the medical doctor, dermatologist, they have to partner with dermatologists, endocrinologists, and other medical doctors. Really important to remember. Now, When you have a flaky scalp, the trichologist will look at your scalp under a handheld microscope. This is why it's important to schedule an appointment if you have uncontrollable flakes. They'll look at your scalp under the microscope. They'll determine if this is cosmetic, if this is environmental, or if this is dead skin cells like scalp pollutants. Once they make that determination, they are also using something called a Woods lamp, and that'll help them to see if this appears to be something that's going to require a visit to your dermatologist. If it does, then they can help you. Now, you may have excessive peeling of your scalp and it's just dry scalp because you are in a very dry and dehydrated environment. We find a lot of that in the winter months. We find a lot of that when people travel, going in these different climates. We find that their skin, scalp is skin, dries out. Your scalp dries out, your whole body dries out. Just pay attention to if you're having to use more lotion on your body, remember your scalp is skin and your scalp may be drying out as well. So if you're seeing flakes, the first thing you want to do is put your scalp in the right environment, clean, acidic, stimulated, hydrated environment so that you can alleviate these problems. If you're not able to get rid of them at that point, then you want to make sure you see your trichologist, and then they will help you to determine whether you need to see a dermatologist. Okay, so the first category, scalp pollutants. As I said earlier, when it becomes excessive, then that would mean that it is a form of dandruff. Dandruff is an excessive peeling of the scalp. It could be infectious dandruff. You can have dandruff associated with eczema, dandruff associated with psoriasis, and we talked about the pulse on the scalp. A lot of times you get those blisters and the pulse and the skin. Those are just, it's good because that comes up. It's just natural the white blood cells and natural antibodies that are out trying to heal your scalp. But you need to see a dermatologist at that point if you're oozing or bleeding or things like that. All right. Sometimes it comes up as scalp acne. If there's scalp acne, then we need to see if that's folliculitis or there's inflammation in the follicle, ingrown hairs. We need to look at that. And what a trichologist can do is they can view that on the microscope, find out what is going on, determine if that's going to be treated naturally or it's going to require medical attention. If it requires medical attention, you want to have that medical attention, because if you don't, what you're going to end up doing is having more scalp issues and problems, eventually causing hair loss. Now, that's your pollutant number one, scalp pollutants. It's flaking, it's scalp pollutants. Then you have pollutants, environmental. Environmental is dust, dirt, and debris. If I'm in my building and I can walk in my building to my car, then I'm going to get flaky scalp. If I'm in the studio, walking from the studio to my car, I'm going to get environmental pollutants in my hair. Whatever's in the air can get in my hair, work its way to the scalp, and then it can solidify and become a flake, and you'll think it's dandruff. So it can just be dust, dirt, and debris. Springtime, summer, months where it's really polluted in the air are times when you want to pay attention to those kinds of pollutants. And then the final one is cosmetic. And this is the one that gets us all. I mean, we all get kind of tripped up with this one. Just a little swig of coffee. We get tripped up with cosmetics because the goal is to get our hair, whether it's natural, relaxed, permanent wave, or it's naturally straight or naturally kinky, it doesn't matter. We want soft, silky hair. My hair is a fro, but I want it to shake. I want to have body. I want to have movement. And that's what you want. You want healthy hair. So we use a lot of conditioning, people in general. I don't use them. I use clarifiers. Some people believe that they need conditioning shampoos. They believe they need to not shampoo at all, just condition. These are things that are very, very real. And what happens, you end up with a problem with cosmetic pollutants. Cosmetic pollutants is just that little extra conditioner that go just staying in your hair. But conditioners are really those conditioners, deep conditioning, they're designed to be rinsed out. The conditioners that are put in a lot of these shampoos are designed to be rinsed out. So they cause flakes. So where you may not have had flakes on your scalp, now you have them because you're using a bunch of conditioning shampoos, or you're not shampooing at all. You're just running conditioner through. Or you use these sprays on your scalp to try to clean your scalp or try to make your hair shine because you don't want your hair to be oily. So there's a cosmetic pollutants. Now what happens? Recap. You have cosmetic pollutants, which is hair products that are not clean, that will not rinse clean. You have environmental, dust, dirt, and debris. And then you have scalp pollutants, most common. Now, what happens, all of these can solidify on your scalp. When you have a hair and scalp analysis, this is why it's crucial, if you have any scalp issues, to see a trichologist, one who uses a handheld microscope, and allow them to recommend the scalp doctor, the dermatologist. Because that way you may be able to take care of something naturally instead of it requiring medical attention. So it's crucial and important for you to give yourself the opportunity to be sure to see your trichologist and your dermatologist. Because if you have solidified pollutants, they will flake and they'll look like dandruff. If enough of those are on your scalp, then you'll have the pulse, you'll have the skin acne, you have all these problems. So we're going to talk about treatment and prevention as well. So what is important to understand is the three categories of pollutants, that not all flakes are equal. So if you think you have dandruff, it could be something else. It could, so if under the microscope, we can see what that is. The cosmetic, we can clearly see that it's cosmetic. Dead skin cells are very transparent. If they're really dull and cloudy, then usually there's environmental in that dead skin cell. So we can tell you what's going on. So if you're just tuning in for the very first time, welcome to the show. Or if you're tuning in, every week, thank you for tuning in. So what you have on your scalp may not be dandruff, girl. That may not be dandruff. So remember that. I'm trichologist Lisa Akbari, your hair doctor, and today we're having a great show. We're talking about your scalp. We're talking about different things that could be a problem, whether you're wearing braids, relaxer, whether permanent wave, whether you have naturally straight hair, or whether you have naturally kinky hair, color. When is your problem trigger? Let's see if we can go back to our chat room. You can email me, lisa@lisaakbari.com, or you can chat with me online. I'll be more than happy to chat with you about your hair and scalp because it's crucial. This is why I'm here each and every week right here on the WDI radio and iHeartRadio. And I'm trying to get to my chat. So let's see if we can get to there and say hi. Let's see if it'll close my, no, it's not closing my box. I know you guys know how to, I can't get my emojis to close down. It's not allowing it. It's got me all locked up. Let's see if I can get that. Well, we're here talking about the scalp, and we're talking about all the things that you need to know about your hair and scalp. And so I'm here today to help you with that. So let's go to our next part of the, let's go back, and I got a list of things that relating to the scalp that I want to talk about. Okay, so let's go back. And let's talk about scalp infections, a different type of scalp diseases and scalp infections and things that you can have. Let's look at that for a minute, because when you have, and let's differentiate what you should see a trichologist for and what you should see a dermatologist for, and what you could do at home and what you and your stylist can do, or your barber. So those things are really important because you have a lot more power than you think. So you first have to recognize what's going on. So I'm going to say we're going to talk about scalp infections, but first I want to start with the health of the scalp. I talked about the disorders, not disorders, but I talked about the difference in flaky scalp and what those differences. Not everything is dandruff, girl. We talked about that. And we want to talk about how to keep your scalp in that environment I mentioned earlier, the clean, acidic, stimulated, and hydrated environment. And then I'm going to talk about scalp infections and different types of infections of the scalp, and just anything that you like to talk about. So if you have a question for me, please chat with me. And you may be doing it up there, but guys, I promise you I cannot get up here. It's driving me bananas that I can't get. My computer is like frozen, and when I put on high chat, it doesn't do well. So let's go with chat. I'm trying to get to the point where I can see your chats, but it's hiding your chat because of the emojis. All the emojis are just like stuck there. You know, I can't understand why it's doing that. So I'm blowing kisses at you and doing all kinds of things, but it won't let me. It puts it up at the top, but it won't let me. Yeah, it won't let me back up there where I can see your chat. I know it's something I'm doing wrong. I'm sure it is, but it's just not working. So it's just, let me see if I can try it this way. See if that'll hide it. Oh, let's see. Yay, I got it. See, I knew it was me. Okay, well, let's do this because I know you guys had these questions and I didn't give them the attention. Okay, so here's a question here. It says, this is from Sylvia. Hi, Sylvia. Welcome to the show. And we have Eco Hair Braiders here. Hi, welcome to the show. Okay, so often I experience single hair strands that pulls from the scalp. It's not breaking. I feel it very easily comes from the scalp. It's very noticeable. It slides right out. My concern is there is no hair bulb. Should I be worried? Well, let's talk about that, Sylvia, because I think that's a great question and it's going to help a lot of people. Now, number one, if you are pulling hair and it's moving away slowly and it easily moves away, what you're pulling away are layers. If it's no hair bulb on the end, you're basically pulling away a layer. So your strand is made up of several layers. You have the cuticle, cortex, and the medulla. Now with the cuticle layer, you're going to have sub-layers to that cuticle layer, meaning you may have, depending on the texture, and texture meaning size of your strand, you could have anywhere from 3 to 13 cuticle layers. When your hair is damaged, if it's dry, if it's been overexposed to chemicals, or if it's overexposed to detangling, then your hair is going to suffer with trying to separate from its body. And the cuticle layers will start to lift and separate. So when you take your fingers and you slide them through your hair, what happens is you may pick up one of those layers and it'll slide straight off. And if you pick up that layer, then that layer is just part of the strand. It's right off the top, and it can come all the way from right where the hair emerged. It's wherever the weakest point is. And generally we find it with people with new growth. We find it with people who use heated tools. We find it with people who do a lot of detangling. We find them, what they think is shedding, but it's called layer peeling. So should you be worried about it? You should be not worried about it, but there's something you can do about it. And this is what you want to do, Sylvia. Number one, every night, you want to make sure that you spray leave-in conditioner on your ends, spray leave-in conditioner. I use one called Hair Vitamin, and on the hair close to the scalp. So you want to make sure that you're blotting that through your hair. Then you want to use a moisturizer on the ends first, and then on the hair close to the scalp. Then you slide in your fingers down, and you want to create like a ribbon smooth feel to the hair. If you have natural hair, I'm sure that's correct. So then you want to make sure that you're twisting that hair. And what you're doing is that leave-in conditioner, especially if you're using mine, called Hair Vitamin, that leave-in conditioner is going to give you some protein, which is strength, and it's going to give you some moisture, which is the hydration, and you're going to balance. So that's important. And then you're going to be able to take that moisturizer, and you're going to keep that moisture level up high, and you're going to create that ribbon smooth. Now, if you're extremely dry and you dehydrate easily, then you want to seal all of that with your oil sheen in a jar, which is the other product. So those 3 products is what I would recommend. The Hair Vitamin leave-in conditioner, and I'm going to type in my website, LisaAkbari.com. So that's LisaAkbari.com. That's my web address. Okay, so you can go on my website and you can look up the information on those products. Hair vitamins, Moisture Plus Moisturizing Oil Sheen Jar. But that's layer peeling. No worries. You have to be careful about that. The other piece is your deep conditioning. Guys, some of you are still not deep conditioning every week. You have to deep condition if you're having those issues. Now listen, believe me when I tell you, I don't deep condition like I should. And I see the difference. I love it because my excuse is I'm conducting a study. Well, we just don't take the time to do it. You see? So it's crucial that you take the time once a week to deep condition to have more control over the health of your hair. Okay, so we have Echo Hair Braider. She has a question. Some scalp acne and pulse seem like, oh my goodness, I can't see that. Let's see, they turn into boils and scabby score. You guys, I don't have my readers on. Okay, and I think what she's saying, she goes, is there a product that can prevent yeah, she wants to know if there's a product that can prevent damage, follicular damage, and start repairing the scalp. I got it. Okay, yes. First, I'm going to say the environment is so crucial. You want to create this is how you start. You start with home and stylist, then you move to trichologist, and then the trichologist will help you move to dermatologist. Number 1, what you need to do yourself. If you have a problem, if you have the pulse oozing, if you have what you're thinking is skin acne, if you have what looks like boils or things like that, then what you want to make sure, that you will see your dermatologist if it's oozing. You just want to do that because whenever your skin is exposed, if your dermis is exposed, then you really have to be careful. Because if you're not careful, you can cause major problems and infections. You can cause all kinds of problems within the body system. So you want to take care of that. But I always ask patients to come in and at least let me take a look at it. And then that way I can help direct them and give them some things to say to their dermatologist. Just really kind of find out, because what trichologists do, most of us, which is a little bit different from a dermatologist, we will do the microscopic view and we will counsel you a lot. Now, you have wonderful dermatologists across the country, and they are going to do some great things. I believe the trichologist is the first stop, especially in this case. But you want to create a clean environment. You really have to look at whether or not that particular individual is shampooing often enough. And I know that sounds like a cure-all. Shampooing is not the cure-all. but it's a big part of keeping the right environment on your scalp. So you have to use a shampoo that has the pH of your hair and scalp. The hair and scalp has a pH of 4.5 to 5.5. It's really important that we honor that pH because the hair is more acidic in the scalp than reaction. So you have that pH. So it's really important. Then you want to make sure clean, acidic, that's the pH, 4.5 to 5.5. Stimulated. You don't want to shampoo with your nails or brush. You want to always use the balls of the fingers, getting under the hair, massaging the scalp, and then smoothing down on top of the hair to prevent tangles. So that's crucial. So you want to clean, stimulate. You want to stimulate circulation because the scalp is an organ. All organs need good circulation, blood circulation. So you want to do that. A hydrated environment. Avoid things that dehydrate your scalp. When you sit under heated dryers, like a lot of people with natural hair do these rod sets, a lot of people who wear relaxed hair do roller sets, a lot of people who have naturally straight hair use blow dryers and brushes. So we have to pay attention to the kind of dehydrated environment our skin is in. Products that dehydrate, some people are still using gels and mousse. Those things are crucial that we take care not to use them because if we're not careful, we're going to end up dehydrating our scalp. All right. So you want a clean, acidic, stimulated, hydrated environment consistently. So when you're thinking about your scalp, I know that you're talking about the skin acne and the pulse. Those are things that are important. If the problem is persistent, we need to see the dermatologist. But a trichologist, one who uses a handheld microscope, can determine if we are at the point where we should see the dermatologist. Okay, so it's crucial. I hope that has helped you. It's Eco Hair Braiders course. All right, guys, welcome to the show. If you're just tuning in for the very first time, I'm trichologist Lisa Akbari, your hair doctor, and we're here today talking about the scalp. Now, we talked about the environment you have to keep your scalp in. Now let's talk about scalp infections because we're just here kind of some of the most common ones. We're here talking about scalp acne and pulse because sometimes what looks like scalp acne and what may look like like it's pulse may be a whitehead, it may be something that's not as serious, and the trichologist can assist you with that. But when we look at scalp infections, the most common ones will be eczema, psoriasis. What are some of the most common ones? And then we have fungal issues. And we want to talk a little bit about that today as well. Because when you have eczema deals with, let's see, yes, thank you so much. Okay, perfect. She said, thank you. So I'm just going to stop. And thank you, Eco Hair Braider. She said, yes, this helped her so much. She said, please keep me posted on your next course dates. Now, if you email me, Lisa and I'm going to put my email address up here. If you're interested in my trichology course or my natural hair school or my cosmetology school, please email me. I'm going to put my email address up, lisa@lisaakbari.com. I'm going to spell that. It's LISA@LISAAKBARI.com. Now, you can email me if you need a hair and scalp analysis. If you're tuning in and it's during the week, you can call 901-380-4445, or you can email me, LISA. Let's do 380. I can't multitask very well here. 4445. Okay. 45, and let's send that out, and I want everybody on the radio to hear me as well. And you can call if you're during the week. We're here Tuesday through Saturday. You can call 901-380-4445, and you can talk about a hair and scalp analysis, or you can get that appointment scheduled to see me. If you're local, we have patients who travel from all over the world. And if you want to email me, you can email me, Lisa@LisaAkbari.com, and that's LISA@LISAAKBARI.com. Thank you guys so much for tuning into the show. We have a few more minutes, and we're going to continue to talk about our scalp. We were just talking about scalp infections like eczema, psoriasis. And what are some of the examples of seborrhea dermatitis? What are some of the things that we see when we notice eczema or psoriasis or seborrhea dermatitis? What are some of the things we should notice? Now, with eczema, if it's on the scalp, it's really, really important to create that environment, the clean, acidic, stimulated, and hydrated environment I mentioned, because eczema you're going to have chronic flaking. It's going to be tender. There's going to be problems like that with eczema, dry, itchy, an itch you can't get to. Sometimes you have, with psoriasis, you're going to notice the pulse and the pimples and the bleeding. You can have that problems even with bleeding. And anytime you're bleeding, that means your dermis is exposed. Go straight to the dermatologist. You can have your trichologist look at it, but for sure, one of the big things you want to know from them is who's the best dermatologist, because you really need to get to that dermatologist. And the other piece is with seborrhea or seborrheic dermatitis. It's just inflammation of the scalp, of the follicle. So what you have is you want to see your dermatologist, but it's just, in many cases, people are diagnosed with that. We found that if you can create the right environment on your skin, your scalp is usually not going to be overactive like that. You'll have the overactive sebaceous or oil glands and inflammation within those areas, but you won't see the effects of it if you have that clean, acidic, stimulated, hydrated environment. And there are natural scalp treatments that I recommend for patients as well, so they do very well. So that sometimes you can treat that naturally. Also, folliculitis, those are important, and especially we find that with men. They're on the nape area, those ingrown hairs, those follicles becoming inflamed, and then you have this inflammation and eventually scarring. Some people develop the keloid skin. It's just really, really a problem. Don't squint, Lisa. Don't squint. You're too young for that. Okay, so there's just a lot that can happen with your scalp. Now, let's make that connection in our last few minutes. Let me make sure I didn't overlook anything. Yeah, we're going to talk about fungal problems as well. But let's make that connection with our hair and these scalp problems. When you're wearing braids, when you're wearing relaxers, when you're wearing permanent waves, when you're just getting your hair roller set, you have to keep a rod set. You have to keep in mind, if your skin gets out of that environment that I spoke about, clean, acidic, stimulated, hydrated environment, you could have problems with your hair and scalp becoming dehydrated. It could lead to other problems. You can lose hair. You can have your scalp over polluted from the flakes, and you can have blockages around the mouth of the follicle, creating density changes, creating problems with alopecia, a form of very surface. You can have problems with a chronic itch. You can have a problem with, and which chronic itch you're going to scratch, and which can break the skin and cause problems. See, what I'm getting to is you must create that environment for a healthy scalp. Okay, guys, that's so crucial and important. And I don't want to lose my thought, but do we have any questions on our chat room? And remember, you can email me if you're tuning in on the radio. My chat room is open, or you can email me, Lisa at lisaakbari.com or call my institute Tuesday through Saturday at 901-380-4445. This is an exciting show today, guys. Okay, we wanted to talk a little about fungal problems. See, that's one that no trichologist or anyone except your dermatologist should treat. Ringworm, any fungal issues, highly contagious. Is very important that you see a dermatologist. And in those problems, now remember, scalp problems left untreated, I don't care if it's a flaky scalp, it's an itchy scalp, it's a tender scalp, I don't care. I'm going to talk about tender scalp in the last few minutes. I don't care what problem it is, left untreated will eventually lead to density changes, some form of thinning. So it's crucially important that you take care of it. Don't leave your scalp problems. There's no such thing as growing dandruff. I haven't heard that in years, but you know we did say that, guys. Yeah, right. But no, the only thing that's growing is the crap that's on the scalp. No, it's not. It's not going to make your hair grow. So just get rid of that. I know most of you don't believe that, but there's some people out there that still think growing dandruff. There's no such thing as that. The other piece you have to keep in mind is that it's really important that if you have a situation with your scalp that you, as I said earlier, you see the dermatologist right away or your trichologist right away. You guys know what I'm doing here. I'm losing my thoughts, my train of thought. But one thing about it, I want to make sure that you email me or chat with me if you have questions. But we wanted to talk about tender scalp. We wanted to talk about itchy scalp. We've talked about flaky scalp a lot. Why does my scalp itch? Your scalp itch is like a headache. Itching says there's something going on within the scalp. You know how with a headache, it could be something as simple as I'm tired or hungry, or it could be something more serious. That's where an itch is. An itch could mean that you just need to go shampoo, or your scalp is dry, or your hair is growing. It could mean, but usually, I hate to say that one about your hair growing because unless you shave your head, you rarely itch when your hair grows. You don't feel an itch unless you shave, and when it grows back, you know how you shave your legs and it grows back, you have an itch. Well, that. But other than that, rarely. But itchy scalp just a signal saying that something's going on, or it could be something more serious problem. So again, creating that clean, acidic, stimulated, hydrated environment will make a difference. I take a swig of my coffee, guys. Yes, I do coffee 6 months out of a year. Isn't it crazy? All right, so that's the itchy scalp. Now, why does your scalp become tender? You have layers of the skin. Your epidermis, I call it the sentinel. The epidermis is like 5 layers thin. Well, on the scalp, it's more like 4 layers. So the top skin on the epidermis scalp is the cornea layer. The bottom epidermis skin is the basal. When you get you have to work through the luciderm, those other layers. You have to work through all those layers. Once you do, then you get to the basal layer. When you get to the basal layer, you begin to feel the true skin because there's really no feeling. You can feel sensation, but you cannot, it doesn't hurt you to rub on top of your skin. When your skin is broken, like have you ever tried to rub inside of a sore? You can't do it, it hurts. Well, that's your pain receptors responding. So if you feel a tender scalp, your pain receptors are basically responding to its environment. So the skin is broken to the point where your basal is exposed and possibly your dermis. The thing is, there are no blood vessels in the epidermis. So if you are bleeding and tender, then you know you've broken through the basal and you're inside the dermis, which is very dangerous. It's dangerous for many reasons. One, it causes scalp infections, staph infection, all these, and it can cause damage to the follicle and can destroy the follicle, creating that scarring. So it's not good to be in your dermis. So when some of you burn with these chemicals, or you scratch your scalp, or you're braiding and you're pulling and you're creating this pulse and it's bleeding, you are in the danger zone. And I treat so many patients with alopecia because of this kind of mistreatment, abuse of the scalp. So it's crucial, guys, to take care of your scalp. All right, so the tender scalp comes because you've broken through your sentinel layers, your epidermis layers, and you're either in the basal, if you are not bleeding, but you feel really tender, you are in the basal layer. If you're bleeding and you feel tender, you're in the dermis. Now, when do you notice that? When you braid, if you pull your hair with braids, that's why it's important to braid tight to the hair and not to the scalp. When you do that, what you're doing is you're basically pulling the skin. And when you pull the skin, then you're still going to have that new growth, and that braid's still going to loosen up in a few weeks, a few months. So it's tighter. It does not make it stay longer. Tight to the hair makes it secure, so that, and you have that little wiggle room at the base, but making sure it's tight to the hair. So your braid technician can almost pinch that in and make sure she loosens it up first. Then she starts her braid, and then she's ready to pull all the way out, but never stretch and pull. She's just lifting it up and braiding it out. That way she doesn't pull the skin. Because when you do that, the mouth of the follicle, the lip, turns outward, and you're exposing it to pollutants. You're also causing a pulling the follicle, and you can cause tenderness. So that's a problem. Also, when your scalp gets tight and dry, you're going to scratch it, and then your scratching causes tender. So most people who have an itchy scalp first, then later on they have a tender scalp. Okay, guys, I've been all over the place with this show today. You don't have to say it. I will say it. I mean, it has been crazy. Okay, she said, here we go. We got two more questions really quick. We said, my scalp likes ASV rinse. So always talking about apple cider vinegar. Maybe that's what she's mean, AS. Guys, I'm not good with these acronyms, but not my hair. Any tips? Well, your scalp doesn't really like it. If we're talking about, so speaking of apple cider vinegar, you can just give me a yes or no. And then I'll go on to needle damage from sewing weaves. Anytime you puncture the skin, you are creating a problem with either puncturing the epidermis, or you're puncturing into the dermis. That is the problem, and you need to have that treated. So what you have to do is stop the weave, start treating the scalp, creating a clean, acidic, stimulated, hydrated environment. I have a scalp treatment. It's scalp treatment level 3 on my website, lisaakbari.com. I have a weave and braid program with scalp treatment level 1. So when you are braiding, you can actually, when you're pulling, you can put that scalp treatment at what I call points of departure, and that you won't pull that skin. And if the problem is persistent, and you should see a trichologist, and at that point, the trichologist should recommend the dermatologist and then get it taken care of. But yes, it's very problematic. Anytime you puncture the skin, anytime you hit the skin with a needle, then it's a problem. And that's why so many people use those curved needles, and that does help. The apple cider, I'm assuming she's talking about apple cider vinegar rinse. Apple cider vinegar rinse, the pH is too low. Your hair is responding to that by the moisture level plummeting, so you shouldn't use it. Just use your clarifier. Your scalp doesn't really like it, But most of the times we have such a horrendous buildup on our scalp, we don't really notice it, and it really helps to break up some of that buildup. So apple cider vinegar rinses basically break up and break down. They don't clean. So what happens is that residue, it breaks it up and breaks down. When you rinse, most of it comes off your hair, but on your scalp, it settles back down. Some of it settles on the hair, and then it just causes a problem with dry hair, and sometimes your scalp will itch later on. So my recommendation is to use a clarifying shampoo, use deep conditioning, protein and moisture, and you will have better balance. And then you can oil your scalp just to make sure you're sealing in the hydration. Guys, I know to some of you this is so different and you just don't really know if you're going to believe me, but I will be happy to have any kind of discussion with any of you. You can go to my website and have a cyber consultation, and I can prove a lot of things to you, show things under my microscope. I will help you in any way you need me to. Well, guys, we are so out of time. I'm surprised they're not cutting me off the air. I'm trichologist Lisa Akbari, your hair doctor. And thank you guys so much for tuning in, but I had to get those other 2 questions in. I'm here each and every week right here on WDIA and iHeartRadio. You know who I serve. To God be the glory. I will see you next week right here on Ask the Hair Doctor. Have a wonderful, blessed morning, evening, or afternoon. I love you guys.